We share the screen. So welcome to our Genius Class 2023. And our next task is baby teething. Baby teething. In this particular case, when FY2 in a GP surgery, the mother has made an appointment to see you, okay? Because the child has not been herself. Child has not been well. Can I change that? She is irritable. Child has not been herself. Child is irritable. Okay? Talk to the mother and address the concerns. Talk to the mother and address the concerns. So opening sentence. Doctor, my child is irritable. Child has been irritable for the past 2 weeks. Okay? Irritable for the past 2 weeks, and she is also clingy. Okay, and she is also clingy. Child irritable for the past 2 weeks and is also clingy. Mother has noticed soreness and redness in the gums. Child is drooling. There's drooling of saliva more than usual. Child is up to date or immunizations. Questions: what's wrong with my child? What can I do? Approach to this particular task: grips as usual. Then you take the history of the presenting complaint. Child being irritable and child being clingy. How long has this been going on for? Okay. History of irritability and being clingy. Okay. We're going to be asking, how long has this been going on for? Okay. When does it happen? Does it happen in any particular situation? Okay. Is it all the time or on and off? Yeah. Is it all the time or on and off? Is the child sleeping well? Yeah. Does she sleep well? That is important. Is there anything you feel could be the cause of the problem? Has it happened before? Then the differential diagnosis, interception. Yeah, usually what happens in interception? Child is irritable, child is pulling the legs towards the tummy, there is diarrhea, there is blood stools, already currently jelly-like stools. Separation anxiety, we'll look at it in a second. Baby teething, tantrums, infections, otitis media, pneumonia, UTI, meningitis, upper respiratory tract infection, gastroenteritis, baby nappy rash, all these can make the child irritable. Now, symptoms of baby teething, what are they? One more time. Most babies start teething at 6 months of age. This particular baby is 7 months. So teething symptoms include baby not being comfortable. Their gum is sore and red. Mild temperature, less than 38 degrees. One flushed cheek. The rash on the face. So the cheek is flushed. So you're asking direct, have you noticed if the cheek is flushed? Have you noticed any rash on the face? There is a drooling of saliva. Okay? Drooling of saliva. Yeah? Child not sleeping well. These are the things that suggest it is a baby teething. Then also exclude separation anxiety, baby being clingy, being irritable, baby being clingy and crying when their carer, that is their parent, leaves them alone. So asking who normally looks after the child. Okay, have you noticed that the child becomes clingy and crying when the mother is away or when the carer is away? Separation anxiety usually develops between 3 months and 3 years. This particular child is 7-8 months. It does fit the age. It is normal part of development. So because it fits the age, it can cause a problem with baby teething. Okay, good. So symptoms of temper tantrums usually starts at 18 months. Okay, so it doesn't fit the age, but it's very common in toddlers. Usually they will be hitting somebody, biting somebody. So hitting and biting are common. Toddlers or a child wants to express themselves, but they're finding the difficulties. Since they cannot express themselves, they get frustrated and they take out frustration by, of course, having tantrums, that's hitting, beating people, throwing themselves to the floor at times. By the age of 4 years, usually the tantrums are less common. Complete the other history, the PMAF-TOSA, the ICE, ask about the child eating and drinking well, child being up to date or immunization, and if the parent is happy with the development of the child. The diagnosis in this particular child is baby teething. Why did we say this diagnosis? Let's go back. Okay, so go back in there to look at the background history. So in this case, it was a child is irritable for 2 weeks, but there is a soreness and redness in the gum. And when you ask about teething directly, the mother may tell you, yes, the child is teething. Okay, they may tell you directly, the child is teething. So this is why, and there is drooling of saliva. There is also, one part of the face is flushing of some rash on one part of the body. Okay, so that also gives you a diagnosis. So Once we have explained the diagnosis in here, that it is what? Baby teething. What is it? It is when the teeth starts coming out. It can cause discomfort and pain. The common symptoms include sore gums and redness. There is a mild fever, so the child may be feverish. And this particular child, the mother will tell you that the child is feverish. There is drooling of saliva, okay, more than usual. And teething usually occurs around 6 months of age, which also fit this particular scenario. And this particular child has got what? Mild fever. So management, advise them to give it teething rings. Teething rings, it eases discomfort and help the baby chew safely. Okay, advise to give the baby healthy things to chew. If the baby is biting the finger, you may see the baby biting the finger. If it's biting the finger, you have to give the child healthy things to chew, such as a fruit or vegetable, instead of biting the finger. Some teething gels may be appropriate for babies. Give paracetamol for the pain, because that irritability or uncomfortability may be due to what? Pain. Care of the baby of the new teeth, you can visit the dentist. So I advise you to visit the dentist because the teeth are coming out. Prevent teething rashes. So there's usually rashes on the face, and that's why it's important to ask if the child has got rashes on the face. Since the child is drooling saliva a lot, you have to clean the face. Okay, drooling a lot, advise to wipe the face in order to prevent rashes on the face. Okay, good. So this is baby teething. Now, comforting a teething baby, what can you do? Give a child a toy to play. It may distract the baby from the pain or from uncomfortability. Gently rubbing the gums with a clean finger. Okay, a parent rubbing the gums with a clean finger, that may help. Give the mother a leaflet about the teething so they can learn more and understand. Thank you.